Hi, I'm Dr. Homewood, Direct Tens. Today, I'd like to review a wonderful outcome that I found with one of my actual patients that combined traditional chiropractic and physical therapy with using an at-home TENS unit. So let's give you some of his history first. So this patient, his name is Nathaniel. I won't give you his whole name for HIPAA reasons, but he was involved in a motor vehicle accident back in July. He went through some traditional chiropractic and physical therapy care. As he was going through the care, he was not improving as we wanted him to. We did send him to get an MRI and found that he had two herniated discs in his neck. To make a long story short, he was later sent by us to an orthopedic surgeon who did surgery to fuse his C6 and C7 vertebrae together. After the surgery was completed, he came back to our office for some additional care. At this time, we continued with post-surgical care, as well as we prescribed an at-home TENS unit to use on the days that he was not in the office and over the weekend to help speed up his recovery time. This patient came back to me later and said that he felt the TENS unit, one, decreased the pain that he was having significantly, more than just the care alone that he had in the office, and also he felt that it decreased the amount of time until he was recovered. To date, this patient is now back to 100%. He's improved with his activities of daily living. He is enjoying life again, and I'm happy to see that he is doing that. My hat's off to him. Because of this information, I went back to look at some of our other patients in the office and did a clinical trial in here. What I did is I looked at 12 patients. 6 of them went through to the traditional care that you would do for a whiplash injury. The other 6 did that same care, but we added an at-home TENS unit in the acute phase, so we actually did it right away. Across the board, we found the 6 people that used the TENS unit as well as the care, that their pain levels were decreased, the pain levels were decreased faster, and the overall treatment of those 6 patients was 30 days faster than the 6 that just did care alone. So treatment wrapped up almost a month quicker by using traditional care combined with the TENS unit. So with that being said, it is my opinion that it is very important to not only seek out the treatment of a physician when you're injured in a car accident and have a whiplash injury. It is important to do that, but it is also important to use and combine that with an at-home TENS unit and possibly other modalities. Once again, my hat off to my patient, Nathaniel. He did a wonderful job with his treatment, and I like to see folks that end up in his position and back to a wonderful lifestyle.